Acentra Health is the beneficiary and family-centered care quality improvement organization for the 29 states highlighted on this map. We help people with Medicare address concerns about the quality of their healthcare services. We also help them make requests to appeal hospital discharges or to stop skilled services such as physical therapy. Acentra Health offers immediate advocacy services when issues with medical care need to be resolved right away. This video focuses on our immediate advocacy services. Immediate advocacy often involves Acentra Health helping to facilitate a conversation between the patient and the provider or facility through a conference call or calling on behalf of the patient. Another option is to start a three-way call between the patient, Acentra Health, and the provider. Here are a few stories to show how this free service works. In the first story, a Medicare patient was ready to leave the hospital and move to a skilled nursing facility for rehab. However, a clerical error was listed in the medical records. This error showed that the patient was not considered inpatient status. Therefore, the patient did not meet Medicare's 3-day stay requirement for coverage. Thankfully, the patient's daughter contacted Acentra Health for help. Acentra Health staff called Medicare. At that time, Medicare explained that the hospital needed to first correct the error and then the move would be approved. The patient was advised to stay in the hospital until the error was fixed to ensure coverage for the skilled nursing facility. The patient's daughter thanked the Acentra Health staff for their help in getting this issue corrected. In the next story, a Medicare patient called Acentra Health with concerns about his medication while at a skilled nursing facility. He had a prescription showing that a medicine was to be given by patch. The patient had unanswered questions about it as it had not been changed. Also, he had to take medicine by mouth, which was to be given 1 hour before meals. However, the staff did not bring his medicine at the right time. In fact, sometimes he did not get it at all. The Acentra Health staff called the skilled nursing facility about the patient's concerns. The social worker confirmed that the medication was to be given 1 hour before meals. Therefore, she spoke with the nurses to make sure it was correctly given. It was also clarified that the patch was not due to be replaced yet. The social worker said that the care team was regularly explaining the patient's medicines to him. However, the patient had dementia. As a result, there were times when he became confused about his medicines. With this information, the Acentra Health staff called the patient to update him about his concerns. His concerns were eased, and he thanked Acentra Health for the help. In the third story, a Medicare patient's daughter called Acentra Health with concerns about her mother's care in a skilled nursing facility. Her mother needed 2 people to help her to the bathroom. However, staff shortages meant that she was told to use a bedpan. The daughter did not agree with this option. She also asked about a laxative for her mother, but it wasn't given. Acentra Health staff contacted the facility's manager. The manager knew of the concerns and said that a grievance process had begun. After speaking with Acentra Health, the manager agreed to ensure that the patient received help using the bathroom. Acentra Health was able to tell the daughter that her concerns would be addressed. Her mother would get the needed help. The daughter thanked Acentra Health and felt the immediate advocacy process fixed the issue. In the last story, a Medicare patient's wife was worried about her husband's discharge from the hospital because he needed to go to rehab. Since he had to take expensive medicines, the nearby facilities would not accept him as a patient. She was very concerned that he wouldn't do well without the medicine. Yet, she did not feel ready to bring him home. She asked Acentra Health for help. Acentra Health arranged a conference call with the hospital, the wife, and the case manager. Working together, a discharge plan was created that made everyone happy. The wife expressed her gratitude to the Acentra Health staff for their help, and she was confident in her husband's care. If you have Medicare, there may be times when you are not happy with your medical care. Other times, you may need help working through an issue that needs to be taken care of right away. When this happens, please call Acentra Health and ask about our immediate advocacy services. Our website, AcentraQIO.com, and other helpful links are listed in the YouTube description below.